You've got this crazy system where all of a sudden 25 million more people have health care, and then the people are out there busting it sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world. The insurance model doesn't work here. It's not like life insurance. It's not like casualty. It's not like predicting flood. It doesn't work.
Who knew? Who knew? That was a month before the election, and that was former President Bill Clinton calling Obamacare a crazy system. However, look at that. Make America sick again. That's what Democrats are saying about the repeal of Obamacare. So where do the Democrats stand on Obamacare? I'm going to bring in David Goodfriend, former Deputy Staff Secretary to President Bill Clinton. You're in a very difficult position, David, aren't you?
Not at all, Stuart, because as you well know, President Clinton was not calling for the repeal of Obamacare.
No, I know that, but he called it a crazy system. And now Democrats are faced with the repeal of Obamacare, and they're saying, oh, it'll make America sick. There is a contradiction there, David. I think you can see it.
I think you're misstating his case. He said that when people don't make enough to really afford the premium and yet make too much to get the subsidy, they're caught in a vice. And his wife, Hillary Clinton, was set out to close that gap and help people who do own their own small business to get a better subsidy. The fact of the matter is, look, the Republicans are finally getting what they want. They're in charge. They've been saying for 8 years we're going to repeal this, and you have massive divisions within the Republican caucus of what to do. Don't laugh, because right now on Capitol Hill. No, I'm sorry, Stu.
How can you not laugh at this?
Let me finish the thought.
Wait a minute. Let me
finish the thought.
You created Obamacare.
It's being faced
with being repealed. It's being faced with repeal, and all you've got is repeal it, make America sicker.
No, I'm sorry. Well, you're a business channel, at least in name. So let's talk about the hospital stocks. Let's talk about the health insurance industry. Let's talk about physicians and pharma. Okay. So if you look at what they're saying about the absence, the full repeal, what they're telling their investors is this is going to be a problem. Okay. And Republicans know it's a problem, which is why right now you're seeing Republicans differ from their leadership on what to do. There's no coalescence.
They are discussing a plan. They are discussing
a plan.
You
tell me, Stu, what's the plan?
Tom Price has had a plan and submitted it many times. Tom Price is going to run Health and Human Services. He's got a plan. They're going to get rid
of the statute. What is it? No one knows what it is, not even you. And that's the point, because now you've got the power to do something about it. Republicans know that if they touch this thing, they're going to get blamed for anything that goes wrong. And they're very worried about that, which is why you had Republican senators voting with Democrats. I can't make this up. Voting with Democrats on a procedural measure yesterday. They're worried about it. Look, if we set aside the politics for a moment,
everybody knows. Wait a minute. Everybody knows, and we've reported widely, that as of February the 20th, the Republicans want a bill on President Trump's desk which says repeal Obamacare. They will then come up with an alternative. They will do that. It is being discussed as we speak. There is a plan. It's from Tom Price. There is that plan. They're going to refine that plan. They're going to refine that plan. Please don't go out there and say, oh, there's no plan. It's going to be chaos, just like Nancy Pelosi did yesterday.
There is no plan that the Republicans all agree on. You have some who say we ought to repeal and replace at the same time. You have others who say we ought to repeal first and then, as you say, maybe someday think about possibly coming up with something to replace. Meanwhile, 30 million Americans, a tenth, 10% of our population is going to experience drastic changes in their coverage and not be happy about it. The entire industry,
and the rest
in insurance, in pharmaceuticals,
lower
in
premiums,
everything else.
And better health care.
The rest. Oh, that's very good. Very good, Stu. I understand. So what you just said,
don't get me wrong, I'm not agreeing with your point here. I will not agree with that.
I'm not surprised. But
the
Stu, what you just said is very important.
Your plan that you implemented for the last 7 years was a disaster, and you know it. It fell to pieces.
I do. I don't know that.
And now you're trying to make political capital out of its repeal. That is
that's rich, Stu. Stu, that is rich. Making political capital. Here you've got a bunch of Republican politicians who've been saying for 7 years we're going to do better, and they don't have an answer. Now, let me just tell you this.
They did make political capital out of it because you lost the election. And Obamacare was one of the reasons why you lost.
The conservative writer, the head of Newsmax, his name is Chris Ruddy. He said, let's assume, I think fairly, he said, that Obama won the argument on coverage, that there are 30 million people who need coverage. Let's just assume that. What he's saying as a conservative is, We need a conservative answer for how to cover that 10% of the American population.
Yes.
What you just said, but you gave it
I'll
away,
tell you how
Stu.
you do it.
Wait, hold on, Stu. Let me finish the sentence.
I'll tell you how you do it.
You said everybody else is going to be fine, and that's the problem Republicans have. You are forsaking 10% of the American population, not to mention the people on Medicare, on Medicaid, who are going to be cut.
Utter nonsense. I do believe you know it. You're in a desperate position. You lost the election.
Read the analyst report on pharma.
The signature legislation of President Obama is being shredded along with the rest of his legacy, and you haven't got a clue what to do about it, other than
that's bull. Come on,
man.
man.
Bull.
Read
exactly
the analyst reports. Read the analyst reports out of insurance, hospitals, pharma. You're a business channel. Read the business people's analysts of this. Don't talk to a politician like me. Talk to the people who actually analyze the stocks, and here's what you'll find.
They're all going up, by the way. That's interesting.
Interestingly, read the reports and see what they say about coverage. If there are less people who can afford medicine, what does that do to pharma? If there are less people who can be insured for hospitals, what does that do to hospitals?
Do you think we can agree on this one? If Obamacare had delivered what it was supposed to deliver, an absolute lowering of the cost of health care, if it had delivered on that promise, a lot more people would be covered today than are covered. I think
you mean more than 30 million?
I think
you mean more than 30 million? I wish more than 30 million new people on insurance
in almost all of its promises, and had it succeeded in that one promise, you would have everybody covered today. And that's a fact.
I think Republicans will enjoy having 30 million Americans pissed off at them for taking away their health care, and we'll see them in 2018.
It's not 30 million.
It's 20 and 9 million are on Medicaid.
How about the Medicaid cuts? How about the Medicare
many of them are
How about the Medicare Part D
Medicaid.
cuts?
And there is
good. Medicaid.
Yes.
So are you saying that they're going to preserve Medicaid? Because right now Republicans are saying they're going to cut federal subsidies for Medicaid. What about that, Stu?
Well, because they have an alternative to Medicaid.
What is it, Stu?
I don't
know what it is.
I don't
You don't know?
No,
precisely.
I don't know.
You don't know, and neither do they.
There's no plan there whatsoever, because there is. I'm going to have Tom Price on this program.
Maybe you believe in Santa Claus and unicorns,
David,
too,
I'm
Stu.
done. I'm absolutely done with this. I really.
Oh, come on. You can take it like a man. You can do it.
No, I'm done. I'm absolutely done with it. You lost. Get used to it. Goodbye, David.
Okay, Stu, we'll see you in 18.